Hello, I'm Dr. Michael Kessler, and I want to share with you some really exciting changes that are going to help you in your office, things that we've created for you. And so we've made a flip chart for you because a lot of you need a little help as you go through with your patients to be able to explain the findings on the HeartQuest Professional. So it's going to be great for your patients and it's going to be a helpful tool for you as well. So Dr. Bicchetti and myself have designed this, and this is what we're going to share with you today and a lot more. So what I want you to do is to go to brainbodysync.net. I know we have a lot of websites for sure, but we put a few videos in here. I want you to watch those. And this information that we're going over today will be on there. Okay? And so, if in that website, I have some documents that are absolutely necessary for you because it will help you, and I'll show you why. Take a look at this. We can actually prevent this, right? This is a cardiovascular risk index I've designed for you. And this is something that you should do right away on every patient. It's so simple. You measure your systole and your diastole, and you look at those two numbers and you subtract them, and you'll get a number. That's your pulse pressure. That's going to tell you if those arteries are starting to become stiff like a pipe. And we're going to explain to you what that means and why that's so important. Okay. And so on this little chart that I've made up for you, we have an actual document that goes with it so you could calculate what the cardiovascular risk index is. And what do you do with that as well? So it's got part 3 here, and you'll be able to check that off. And we have on the sheet that is the kind of explanation sheet. It will explain all this for you. And what do you do? Well, we have vascular support here. I personally like to use the US enzymes. They have something called Therazyme. If the vessels aren't so bad, maybe they're mildly or moderately stressed as far as the flexibility and the compliance of that vessel, maybe I'll use Therazyme. If it's worse and the numbers and the scores are a little worse, I might use the combination of Cerezyme, Natozyme, and Lumbrozyme from US enzymes. I may give them a nitric oxide product if appropriate, right? And usually I use 2 different nitric oxide products. I'll use Berkeley Life, which is a whole different pathway. And then I'll also use one of the products that has, beetroot and L-citrulline and those kind of products. OptiNitric is a good one. Bob Miller from Functional Genomics has a good one. Whatever it is that you're accustomed to using, you want to increase the nitric oxide in most conditions. Some conditions we don't want to increase nitric oxide because sometimes it can convert to peroxynitrite, which actually damages the arteries if they have a situation called NOS uncoupling. That's another subject in itself. Omega-3 fatty acids we want to give them. CoQ10 for strengthen the heart muscle. I like the Drucker Labs because if you've seen those videos where it lights up a light bulb, which is pretty amazing, just sitting in the mineral solution, that's an incredible, it's called Intramin, and that's a great product as well. So there you go for vascular support. And then as far as recovery for the nervous system, when we're talking about cardiovascular issues, we definitely want to make sure they're sleeping. And that's a really important thing. Neurovisor sleep sessions or routines in the Neurovisor program. Manage stress. They have a great set of programs in there to help the person calm down and relax that they can do at home on a regular basis. Peaceful Heart may support vagal nerve system tone. Really, really important. Calm down that heart, right? Electrical vagal nerve stimulation may be considered. Make sure they're breathing. There's good breath work. There's, those of you who use that with their patients to get them to breathe properly. Most people are holding their breath. And that's a big deal as well to increase vagal nerve system tone, right? Lifestyle, we want to make sure they're on an anti-inflammatory diet. We want to make sure that they are moving the body. All my patients move their bodies one way or another. It's really important. I live in an active adult community here, and when I go to the gym here, I see the folks that have been moving their body. They're in their 70s, 80s. They've been moving their body their whole life, and they are certainly in much better total physical condition and shape and health than the average folks. Remember, exercise increases mitochondrial function and density and more of them and all that good stuff, right? Adaptive conditioning when appropriate, whether you're, doing things like hot and cold, or you're doing things like if you're doing short duration, high intensity type training, that has an effect on improving autophagy and all those good things as well. We like hydration. Make sure that person is drinking enough clean water, real important. And stress recovery pacing, make sure that they have enough time if they're training to have time to recover and don't keep pushing the body. That will break it down. You guys all know this. Big deal. I like to use the RubyMed remedies. Those are amazing. And if you want to know more about that, you can call me and figure out exactly what the conflict is that's affecting that particular person, that's playing in the background, affecting their physical body, right? Individual support addressing specific energetic, psycho-emotional patterns that may create repetitious patterns in life that may not be desired. People tend to attract the same things over and over and over in their life, and they don't know why. And that's from the, you know, subconscious, deep emotional things that are playing in the background. And we want to try and see if we could bring that to the surface and out, right? Over time, these patterns may affect the physical system, right? And so there we go. These are energy psychology techniques. If it's in your scope of practice, chiropractors like to use NET. I use NET. Neuroemotional technique, along with the RubyMed remedies, much more powerful. EMDR. My sister's a marriage and family counselor. She uses a lot of EMDR and something called brain spotting. Another energy psychology technique, thought field therapy. It's another one of the tapping techniques on the meridians where they're holding on to a particular stressful thought, right? And so, again, those are some things that we like to do. And we have the sheets for you on that on the website. This is the practitioner interpretation guide for you. And I highly recommend you look at that. And that will help you with the scoring, to be able to score an actual cardiovascular risk index for you. Again, we highly, highly recommend that all your patients use the NeuroVisor because it does so many good things to change the brain, to unstick a stuck brain, which is most of the people that you're going to see. And you can read all that. And that's something that we definitely recommend, right? We're going to make a flip chart for that as well for those who have that. We also, we've added a lot of things, right? This is the cell danger response, and I'm going to do one for each phase of the cell danger response, and I'll have a whole video explaining the whole cell danger response because it's a big deal. It's when the body goes into defense survival. This is a questionnaire for you to help you with that because there's so many triggers to the cell danger response. And we have this whole thing here. You can see the different headings: energy collapse, hypervigilance, threat detection, inflammation, immune patterns, autonomic dysregulation, free shutdown, where they've gone into the state where they're not going into sympathetic fight or flight, they've gone into shutdown mode, right? And there's a scoring system here. So as we uncover and figure out what is the trigger locking them into the cell danger response, one that is going to change their whole physiology, and it's okay for a short time. When it's stuck, it's going to cause a lot of issues, and we'll be talking about that. But it's important to be able to, if you're going to uncover for anybody, where does triggering the cell danger response one? Is it Is it a toxin, a pathogen, psycho-emotional? It can be anything. We do have a test kit. If you would like that test kit to be able to uncover that and you're doing bioenergetic medicine, please give me a call. At the end of this, I have my number. So here's the disclaimer before we even get started and show you what's on that flip chart. Here it is. This is for education and research purposes only. The information presented is designed to explore the autonomic nervous system, adaptability, physiological stress patterns, cardiovascular regulation, HRV research, systems-based physiologic interpretation. This material does not diagnose, treat, cure, or prevent any disease. The concepts and discussions presented are educational, investigational, research-oriented, intended for professional learning and scientific discussion. Clinical decisions should always be made by a licensed healthcare professional using good history, right? Examination, laboratory testings if needed, imaging if needed, clinical judgment, and work within your scope of practice. HeartQuest Professional HQP is intended as an educational and physiological assessment tool focused on the autonomic nervous system adaptability and physiologic regulation patterns. There you go, in a nutshell. This is really important because I've spent a lot of time putting this together. I will do more for you. I do not copy this. Copyright notice. All presentation materials, graphics, concepts, educational content, and teaching models are the intellectual property of me, Dr. Michael Kessler. No part of this presentation may be copied, reproduced, distributed, recorded, transcribed, modified, stored electronically, shared in any form without the express written permission of me. Because, this has taken me a long time, many years of research and working with this system to put all this together for you. And I will continue doing that if you like this. I think you will like this. This is the first part of the flip chart. Okay, understand your HQP metrics. Your HRV tells the story of your body's ability to adapt, recover, and thrive. This is for you. You can flip this in the back of your chart because it's mostly for you. I don't think you need to show this to the patient. HQP clinical workflow. Where do I start? First, you're going to pull down the cardiovascular screen on the top there and look to see what the rejections are. And you already know this. But if it's over 20, do not interpret. Try and, repeat the scan. Make sure they didn't move. Make sure they didn't have stimulants or coffee right before or exercise right before. Make sure, this is really important, they're not wearing an Oura ring or one of those devices that may interfere with your heart rate variability, HeartQuest professional reading. Okay? Check it. Check your pulse pressure. So we're going to talk about cardiovascular prevention here. And what we want to do is right away, just get a good, clean blood pressure. Follow the rules of how to do a good blood pressure. Make sure that they're at the heart level, their arm, and all those good things, right? And so when you measure that, what we're looking for is the difference between systole and diastole, and you'll take that number. Just subtract systole from diastole, you'll have that number. Again, if it's over 60, their arteries are becoming more stiff, like a pipe, right? And we'll talk about that and what the implications are. Check the stress index. Determine overall stress load on the system. Check total power. Evaluate physiologic reserve and energy availability, because everything depends on having enough energy to be able to adapt and to change when change is necessary. Low total power, then they're going to have trouble there. And we'll tell you what we want you to attempt to do. Okay? Check SDNN. Evaluates overall variability and adaptability. When people talk about heart rate variability, mine's really good or it's bad, it's usually talking about the SDNN, and we didn't put it in here, but the RMSSD. Those two parameters right on your screen there. And remember that you can break that down. You click on the SDNN or the RMSSD, And what happens? The drop-down menu comes down and tells you what it should be for that particular age. Check HF, percent parasympathetic. Evaluate recovery and parasympathetic activity. So in anything that you read, you need to have enough HF, that part of the green pie that you'll see on the hard quest, to make sure that they have enough green HF percent, because that's your parasympathetic, to offset the stress response. Really important. Look for patterns. Review combinations and trends across the parameters. Never look at one thing. Okay, so let's go a little further. Why do we look at the pulse pressure? And what is the pulse pressure? When we talk about the pulse pressure, your heart, when it beats, it sends out a forward wave pattern. It goes all the way down to your femoral arteries, your periphery, and returns back. So you have a forward pattern and a return, and a return waveform. So you have these two waveforms, and if you got a healthy timing, the vessels are compliant and they can stretch and do what they're supposed to do, it comes back within a certain time. But if it's stiff, it comes back too fast. When the heart is putting out its next forward wave in systole, and now you have resistance between the forward wave and the returning wave. And that makes the heart work a lot harder. Puts a lot more pressure on the heart, and worse than that is that creates a situation where we have less rest time for the heart. That's in diastole. You'll have less rest time, and in diastole, that's where the heart gets its own blood supply to the coronary arteries. It's a high stress, issue here. And so high pulse pressure puts strain on your arteries in your heart, reduce the strain, support vascular health. And we'll show you how to do that. I have a couple things on the right there. US enzyme supports healthy inflammation control and vascular adaptability. They have some enzymes we'll mention that we've tested on another device that measures the pressure at the aorta, called the CASPRO. Very expensive device. We're going to show you how to do that, just measuring the pulse pressure and looking at some of the parameters on the heart quest. So when you measure the pulse pressure, we will share some of those parameters with you as we move further down here. But you could give them those enzymes, you could do nitric oxide support, and you could give them omega-3 fatty acid support. We'll get into that as we go further. But these are the flip charts for you to be able to explain some of these things to your patient. And if they have this going on here, right here, and they have stiff arteries because they have a high pulse pressure, there's a big spread, is what I should say. The spread between systole and diastole is quite large. Like I said, 60 millimeters mercury. And you come here, and they have a high stress index. That's a higher cardiovascular stress, right? So this measures chronic stress, keeps your system in overdrive. That's your stress index. Lower stress, better heart rate variability, stronger performance, right? And here's some things that you can do on the right. Recovery. You want to help that come down, that stress coming down. That would be, you got to make sure they sleep. Sleep support. You can use the neurovisor, deep sleep renewal, sleep and restore, delta calm, night reset. Sometimes they change their programs on the app, but they have a whole sleep program in there for you, and we highly recommend it. It helped me immensely, and I'll tell you why as I go further down the road here. Adaptogenic herbs supports the body's natural resilience and balance. We know about adaptogenic herbs, ashwagandha and rhodiola and holy basil and Siberian ginseng. And again, we want to reduce that stress. Sometimes we want to deal with that psycho-emotional aspect. Depending on your license, there's neuroemotional technique, there's EMDR, desensitization, and reprocessing, thought-filled therapy. And there's a lot more. I know some of you are doing different things. Always add in the RubyMed remedies. They're just amazing. And you want to work through whatever shows up there And once that remedy is done and resolved, whatever the conflict that's showing up there, you don't want to stop. You people mostly have 3 to 5 layers that you want to go through with that, and you want to get through them all. So RubyMed remedies individualized support, addressing specific energetic psycho-emotional patterns that may create repetitious patterns in life that may not be desired. Over time, this has an effect on the physical body. So when I say repetitious, because most people keep repeating the same patterns over and over again, whether this people, places, things, events, whatever it is, those patterns keep repeating like a boomerang, keeps coming back to them. And we want to break that pattern so they can have a happy, healthier life. And that's a big deal, right? So here it is. Total power. We find that low on a lot of folks, right? Energy is the foundation of performance and healing. And so what do we want to do? Well, we have on the right there solutions for you. Mitochondrial support, fuel your cells, improve energy production. Consider NMN, nicotinic mononucleotide, NAD products. This one's from Quicksilver, NAD plus gold or platinum. I like from Research Nutritionals. I like ATP 360 or ATP Fuel. There's some really good peptides, such as MOTS-C, and there's more that you probably know about. There's anti-inflammatory nutrition. So, here it is. We like to protect your system. Again, not only to help with the cardiovascular stuff, but reduce inflammation and a lot more. Sulfarazyme, US enzymes, Therazyme, US enzymes, omega-3 fatty acids, turmeric and ginger, and any of the other great tools that you guys have in your arsenal to reduce inflammation in the system. Strategic fueling, support stable blood sugar and energy availability. So we want to make sure they have a stable blood sugar. We want to make sure that they're not eating the SAD diet, and we want to make sure they're reducing the refined carbohydrates. Eat some real food, right? And that's a big deal. You should have a program for them that you can give them what they can eat. And if not, we'll put that on one of these for you so you can go over that with them. I don't mind doing that if you want me to do that. Recover and sleep. Recharge nightly. Perform daily. So basically, recovery and sleep, big deal. Use Neurovisor sleep sessions or routines to support deep, restorative sleep and recovery. I say that over and over again, but it's a big deal. For recovery support, consider the program for that. To recover from burnout. That should be is Peaceful Heart. I use Peaceful Heart a lot because it increases parasympathetic nervous system tone there, right? Vagal tone. And there you go. Total power, big deal. It's going to affect everything on the HeartQuest system. You got to bring that total power up, okay? And these are just some suggestions for you. SDNNs, that's the gold standard in heart rate variability. Reflects your body's ability to adapt and recover. More variability, more resilience, always better health. And here are some things over on the right again, and you can read those as well. One of the big important things, really, I think, is that a lot of people hold their breath, and you want to make sure they have good diaphragmatic breathing because it increases HRV. It improves HRV, which is your SDNN that you can measure. The SDNN, by the way, is a great prognosticator for all health issues. The higher that goes, the better their health, okay? So we want to make sure that patient's moving. We want to make sure that they have good sleep. And there you go. And we want to do anything, again, that's going to help to reduce the stress. And I mention it over and over again. You want to use some of the relaxation programs in Neurovisor. It's just something simple the patient can do every day. HF has many hats. We know that with HF, which is your green pie on your HeartQuest, we know that if it's high and they have good total power, that's amazing. Usually you see that in young people, athletes, pretty good, right? And on the right, you can kind of look at that, of how to support that. Mostly, what we're going to see in practice is a high HF percent and low total power. And that is, adrenal exhaustion, mitochondrial dysfunction, chronic stress load, inadequate recovery, all the things that we've been talking about here, right? So we got to get that HF up. And so the person that we see most of the time is in this, again, in this particular pattern. And they're exhausted, tired all the time, burnt out, low energy, poor resilience. And so there you go. And that's the HF, low total power. And here's what we see a lot. If you see a big HF, you better make sure that they don't have rejections. Remember, if it's over 20, you can't read the test. It's false. And on the right, we put some things there for you. No excessive movement when you're testing them. No stimulants, including caffeine, because sometimes, like with an arrhythmia, it's going to make the heart rate variability look better than it is. Sometimes with movement, and it's going to make it look like there's better heart rate variability, and they have this big green pie, and you go, oh, this is great. No, it's not great. They were moving. You left the room, and you left them by themselves, told them not to move, and they're moving all over the place. No stimulants. Again, caffeine. Maybe they're on some medications that are stimulating. Maybe they just exercise, So you want to look at all these things beforehand, okay? And again, low total power is a big deal. We already kind of talked about that with, a low HF and a low total power. That's the pretty depleted folks there, right? And this kind of summarizes it all for you on one page. You could pick what pages you want to use when you go over these things with your patient. LF. I did a big thing on LF because it's such a big deal. It says on the top, LF reflects the body's ability to regulate blood pressure, adapt to stress through the baroreflex system. So on the top, it says baroreflex blood pressure control. LF reflects the body's ability to regulate blood pressure moment to moment via the baroreflex. So, and then underneath it says vascular tone and blood vessel control. So here's the deal on this. We have a control system of the body that controls and regulates blood pressure through the baroreflex system, right? We have these little baroreceptors in our carotid artery and in our aorta. And when the artery stretches, they get pulled and they pick up this information and they send it to where? The nucleus tractus solitarius in the brainstem that knows what the set point of the blood pressure should be, and it adjusts it. It adjusts it by sending impulses or information through the sympathetic to the heart via the sympathetic or parasympathetic. Parasympathetic to slow it down. Maybe it will inhibit the sympathetic firing. And it's this control mechanism. And the LF is a reflection of this system, and when it's working too hard, and maybe it's working too hard because the arteries are becoming a little more stiff and that system isn't working as well, and the LF has to make up for that and try and compensate via the autonomic nervous system, and you have a high LF. So if you have a high LF and a high pulse pressure, you want to take care of that, right? You want to use nitric oxide. You want to use all the things that you like to use in your practice. I like Cardinorma from BioResource, Coral Calm from BioResource, sometimes Congoose from BioResource. Because I can put them all in the same glass, I can use the enzymes, always the enzymes from US Enzymes. Okay, so I might use the Therazyme. I might use their product. If it's real bad, I might use their Lumbrozyme, their Nanozyme, and their Cerezyme, and have them do them all on an empty stomach, maybe twice a day. And so LF rises when the body is mobilizing resources to meet stress. So that's the other factor there. Challenge or physical demand. You'll see the LF, which is the yellow pie, elevated where? You'll see it elevated a lot in young people in their middle age because they have to raise families, they have to work, they have to have adrenaline. That's your adrenaline. Okay, so stress physiologic demand is there. You can read all that stuff, but you can look at the chart in the middle there. LF increases when your body needs more support and mobilizes resources. So where's it going to become more elevated? Well, physical stress, exercise, mental demand, environmental challenge help support blood pressure balance, vascular stability, adaptive response, and improve resilience. Okay, so there you go. And you can look at that support LF balance at the bottom there. And the last but not least, which is a big deal, which we see in most of our patients who are having issues, because this represents a lot of things. VLF is the signature of long-term regulation and stress load. Lower is generally better. Okay. And so that's your hypothalamus. That's your central nervous system function, which is, when that's the predominant feature of your pie, it's going to steal energy. The reason is because the autonomic nervous system, which is your yellow pie and your green pie, is fast speed internet to help your organs to make changes very quickly in your system, because it's in control of all your organs and glands, right, as needed in response to the environment and stress. The brain, though, is a little slower. You get the stress response, the brain goes, stress, and it's going to trigger certain hormones. It's going to trigger cortical releasing hormones, and that goes to the pituitary, and the pituitary is going to release ACTH to the adrenal glands through the blood, through the system. That's going to send that information to the adrenal glands to reduce cortisol. It's all humoral in the bloodstream, which is slow. To get those hormones from one place to the next, it requires a lot of energy. So hypothalamus and stress cascade. Perceived or real stress activate the limbic system as well sometimes, which is going to influence the hypothalamus, by the way. And we'll see that with the big red pie. That's where we store all those old threats and triggers that sometimes, the example I always use is you had somebody who beat you up when you were a kid with red shoes, and you're in a coffee shop sitting there, you see somebody with red shoes, it doesn't register that, they got beat up when you were age 5, but all of a sudden you notice your heart's palpating, you notice that you're sweating, you're going into a sympathetic stress response. We see that with anxiety and PTSD, but that's the red pie. That's the limbic system where we store all those old threats. The body's just trying to protect us. And even though it's not rational, that's what happens. Okay? So we want to break those patterns. I'm telling you, use the neural visor, use some of those other techniques that we talked about, use the Reba remedies, the RubyMed remedies. Those are just some really good things you could do. HPA acts in cortisol release. So the hypothalamus triggers a cascade of hormones, ultimately releasing cortisol from the adrenal glands. Cortisol is an anti-inflammatory molecule, but chronic stress leads to cortisol resistance, reducing its protective effects. You lose that anti-inflammatory effect and a lot more. So we have also VLF is really what we see, that red pie increases as we age. We have less autonomic regulation and more function from that HPA axis, kind of what we call block regulation. So high VLF is seen with metabolic issues like syndrome X as well, and insulin resistance, inflammatory, anti-aging. In other words, there's a lot of things that are going to trigger that high high VLF. What I see sometimes, if a person comes in and they're a little bit overweight, usually they have insulin resistance, they're usually going to have a big red pie. Although I've seen people who aren't so obese or overweight and have a high VLF and are still insulin resistant. Ask them about their diet. Make sure you check that. And sometimes you'll see that, and they may have those kind of things. We always see that with aging, the VLF comes up. We mention that. And if somebody's 65 years old, they usually have it just turns out that way, 65% VLF. And if they're less than that, it's better. Okay, this is a little caveat there for you. So VLF naturally increases with age. In a younger person, high VLF suggests significant psycho-emotional overlay. Shouldn't see that in a young person where they have a high VLF. In an older adult, lower VLF indicates greater resilience than higher VLF. Aim for VLF lower than expected for their age. Okay? It's an energy drainer, which we talked about. So you can go to the middle chart here, and here it is. Limbic system, primitive brain, stress, old threats, or unsafe situations. And it can be triggered by anything that reminds that brain, that limbic system, of danger. It could be a smell, sight, sound, thought, experience. Triggers bypass the cortex and activates the limbic system. The rational brain is bypassed. HPA axis activation, again, we talked about it. Hypothalamus, pituitary, adrenal glands. Chronic stress, feedback loop. Chronic activation leads to cortisol, resistance, and ongoing stress signaling. Okay? So there you go. You can read the rest of that. And that's just, VLF is a lot of things, but I see that always in my chronically ill folks. I want to thank you for listening. And again, I thought we were done. Okay, we're not done. We got a couple more. Sorry about that. We talk about total power. Again, it reflects the overall strength of your autonomic nervous system and your body's capacity to handle stress, recover, and thrive. And low total power on the right there, you can see that is going to affect all the parameters on the Heart Quest Professional. There you go. You can look at that. We have good stress in there versus bad stress. And you got the pie here on the good stress, and this person has good HF recovery, good LF activation, good VLF stress, well regulated, right? They're not in a chronic stress situation, and high total power, strong reserves. As opposed to the other side of the equation, they're overloaded, dysregulated, they're exhausted, excess activation with poor recovery, low HF, poor recovery. High LF chronic activation, high VLF stress overload, and low total power, right? Low reserves. So there's your good stress, and there's your bad stress. You can read the rest of that on your own. This is the time domain, and that's one of the big markers in heart rate variability, is to read the time domain, and what that is your SDNN and RMSSD right on the top of your page there on your nervous system screen on your HeartQuest Professional, and you can read that. I'm not going to read all this to you because I've probably talked enough, and you can see what the scores mean and what that means, but that's a big deal. You want to track your patients. You want that SDNN to come up, and you want an RMSSD coming up as well. If you want to look at the total power, this is just kind of breaking it down from high total power, strong battery, moderate total power, medium battery, and what that means. What are the consequences of that? And low total power, and what the consequences of that. And that's a good one to use with your patients to show them where they're at. If you look at the last one, low total power, low reserve and adaptability, overwhelmed by stress, poor recovery and fatigue, high risk for illness and burnout, system is in survival mode, right? Now, we have several pies right here. And we have the balanced adaptive pattern. We have the sympathetic dominant pattern. We have the exhaustion pattern. We have the emotional limbic overload pattern. We have the low total power pattern. We have the arrhythmia false HF pattern. And we have the adaptive athletic pattern. So those are just some patterns for you. And, as we're treating and working with our patients, the pie, we want to see it change. Mostly I'll see it red pie VLF, and then all of a sudden now they got more yellow, and now they got a little more green. We want to start moving them in that direction, okay? This is kind of a really cool slide for you. What changes the pie? Factors that influence your autonomic nervous system balance. So if you look at the one for inflammation there down below, it's telling you that they have a really high VLF, they have very little HF, and the LF could be variable, but the total power is really low. If you go across that, it says inflammatory or illness burden is driving the system. Infection, chronic pain, autoimmune activity, allergens. So it's giving you some clues as best we can with what these different pies mean. And there you go. That's a real valuable slide for you. And HQP supplement strategies, again on the pulse pressure, you can see there if it's elevated, Therazyme, Cerazyme, Natozyme, Lumbozyme. You're not going to give them all. I give them Therazyme, or I'm going to give them all three if they have really high pulse pressure, or they have a history, they have stents put in, those kind of things. Nitric oxide support. Make sure if they're on blood thinners, you got to, be careful and use caution, because if they're on blood thinners and you're giving these things that are, omega-3s, and you're giving these enzymes, that's going to thin the blood even more so. So always check that. And there you go. Make sure they're moving. I have walking program in here, but I like to go a little beyond that and make sure they're stressing the system and improving mitochondrial function, increasing bone density, and stressing all the different physiology of the body with a little more stronger exercise if I can do that with them. Okay, if I can get them to do that. And again, you can look through this, and pretty much it's pretty well laid out for you to go over these things with your patient. So there you go. Pulse pressure, those are the pressures we talked about when you're measuring the systole and diastole, and you're subtracting that, you get a number, and you can see the high risk range, 60 millimeters mercury, higher risk of cardiovascular events, strongly associated with stiff arteries and increased strain on the heart. Okay, and then the HQP parameters are going to amplify that. And there again, pulse pressure, there's what we suggest in there for you, a little more depth on what these different products do. There you go, because this is a big deal. We could prevent and save some lives here. I think that's a big deal. And that's all she wrote. This is what the flip chart costs. This is a special. It's going to be a little more if you're overseas, for sure. But right now we're doing an introductory price, and you can give me a call. The number's up on the top there. The 415-646-6112. I'll pick up. We're old fashioned. We don't have a robot yet doing that. We don't have AI doing that. It's me. You call me and we'll send that right out to you. There's the flip chart. And if you like this, I have other ones that I have designed for you. I have also some new videos that I'll be shooting and will be on that site, on the new site, which is brainbodysync.net. Brainbodysync.net. Go there, and all the stuff will be up there. You can watch it, and go ahead and if you want to call me, just give me a call. Thank you for listening, and we will talk to you soon.